Hello everyone, this is Dr. Akshita Shanbag. So today in J.T.Keynotes we will study the ninth remedy in the Kent lectures, that is Ailanthus. So about Ailanthus, Kent says it is suitable in low zymotic forms of sickness as in diphtheria, scarlet fever, blood poisoning and typhoids. He says in this drug there is capillary congestion, so which is seen as in spots where red mottled spots are seen, and this can be converted into a purple patches with edema, which is also seen in baptisia. So in scarlet fever, in typhoids, in zymotic, any zymotic forms of sickness. So zymotic you call it when there is contagious, when the sickness is contagious, infection is contagious, you call it as zymosis. So here, especially in scarlet and all, you will have some skin spots seen. So skin rashes will be seen. So here the skin rashes will be because of capillary congestions which are seen in red mottled spots, and especially in the scarlet. So in scarlet fever, he says there are regular rashes which does not come out but has red spots. So the rashes what you expect in the scarlet fever won't be there, but you find red spots in it, and there is no uniform spread of eruption or suppuration. So this is seen in Ailanthus remedy. If you are selecting Ailanthus for a scarlet fever, you have to see these features in it. Then there will be bleeding from gums and nose, dreadful tumefaction in the throat, and congested eyes, that is redness of the eyes will be there, and you can see great prostration but has stupefaction. Stupefaction in the sense they will be having more drowsiness. Then he looks very stupid and benumbed, and in children there is decomposition of blood which goes on very rapidly. So you find black blood, and there is child becomes difficult to arouse, and the blisters are also seen on the ends of the fingers or here and there over the whole body. There are fetid odors from the mouth and the nose. The child is going as rapidly as possible into a malignant disease. So you will find that this rapidity you will find in the Ailanthus, where there is inflammation and rapidly it can convert into a malignant scarlet fever. So he gives three conditions of fever where if a patient or a child is having a light febrile attack, febrile is the fever condition. So if the child is having fever after taking cold, so he may develop into low typhoid form with no symptoms. So then there will be symptoms like sudden state of prostration with rapid heart, fever, purpleness or blueness, mottled appearance is seen. As I said you in the first slide, where Ailanthus will have capillary congestion which will give red spots in it, and further it will be converted into purplish patches. So this you see because of passive congestion of the blood with the purple blotches of the skin, and this can convert into suddenly the blood poisoning can occur and symptomatic typhoid state will appear. This is in the first phase. So in remittent fever, if the patient is suffering with remittent fever, within 24 hours it may go into a sharp zymotic state. Then similarly the diphtheria condition also, within 24 hours the person may have stupidity and mottled skin. So this is seen in the Ailanthus. So he gives some mind symptoms also, where there is continued dreamy state though awake, and sees little animals like rat running around, and feels rat or something small crawling up the limb and over the body, and there is constant loss of memory, even the things spoken of a moment ago go right out of the mind. That much is the loss of memory you find in this remedy. All past events are forgotten. or remembered as belonging to someone else or as matters read, as if he had dreamed them. So he had dreamed about all these things, he will feel. Then he cannot concentrate the mind in any mental effort. He cannot answer questions correctly. And semi-conscious state to complete unconsciousness is seen in this drug. These are the mind symptoms you get. In zymotic state, it is associated with, he says, with great anxiety, restlessness, stupor and indifference to everything, continuous sighing with depression of spirits, and muttering delirium with sleeplessness and restlessness. These are seen with any type of zymotic fevers. And then Dr. Wells used this as an epidemic remedy for scarlet fever in Brooklyn. This changed the character of the malignant forms of scarlet fever into a milder type. So when this remedy was used as an epidemic remedy for scarlet fever, so it was seen that the malignant condition of the scarlet fever was converted into a milder type. So this is seen in the Ailanthus. Coming to eyes symptoms, same thing, you will find congestion and all. Along with that, there are few other symptoms you get, like flashes of light before the eyes on closing the lids at night. Pupils are widely dilated, and in the nose you get copious, thin, aqueous and bloody discharge, and nostrils will get congested. There is great prostration and countenance indicating much distress. In face also you can find there is purple, bloated, puffed, distorted face will be seen with distressing countenance. So there are three common types of scarlet fever he gives. Kent speaks about the scarlet fever. He says one is scarlatina simplex, scarlatina anginosa, scarlatina maligna. So this remedy is used in all types, mainly the third type. So coming to throat, we find there is dreadfully swollen, inflamed, bright red and very painful throat. If it is a third type of diphtheria or the throat inflammation, you find the throat is severely swollen, all the mucous membrane are swollen, there is poisoning or zymosis state with enlargement of the glands, puffiness of the skin, great deal of fever. So he says the throat much swollen, dark red, almost purple in color, diphtheria with extreme prostration, throat is livid and swollen, tonsils are prominent and studded with deep ulcers. This is the third type, so malignant type of condition. So throat and tonsils appear as if they would split upon pressure, like a dropsical state. So when they would pit upon the pressure. Dropsical state in the sense swollen with the fluid inside. Then next, sometimes it is associated with horribly offensive diarrhea, and that it can be even a critical diarrhea, like you find it in the cholera and all. Also associated with pain in the back of the neck and head. So in any fever condition, in Ailanthus you will find that the chills come at 8 am with chill, heat, sweat, everything. Then during the chills, the patient may have vomiting of food, piercing pain over the hip, hunger with empty feeling, and there is intolerable pain in the back of the neck, upper part of the back and hip joint. During heat, he feels there is congestive attack of great violence with fullness of head, breathing hurried, irregular and heavy, burning in the palms and soles, which hunts to find cool place to put them. Okay, so this is what you find in the during the heat stage. He feels a rat running up the leg, feeling as if a snake crawled up the leg. So you can compare here many remedies. So try to see where you will have these symptoms in the other remedies also. So pulse will be very small and rapid purplish appearance of the skin. Electric thrill from brain to extremities will be felt. So in skin, as I said, there will be bright red, smooth as shiny, scanty rash with congestion of the head and spinal symptoms which come on with the pain in the back of the neck. Skin will be dusky, eruptions are always scanty, sometimes hardly visible from beginning to end. He says in some epidemics you will see all of the appearances. In some families you will see just two forms. So one may have mild type and one may have more severe zymotic blisters here and there and on the ends of the fingers. So in malignant type, the blisters will break and ulceration will take place if the child lives long. And in the low type of scarlet fever, the rash does not come at all. The impression of the finger will make a white mark which will be slow to fill up. Like if you are pressing the finger, so you can see that is blanching, what we call. If you blanch, so what happens? During the pressure spot will become white in color, and immediately when you release the finger, you release the pressure, again the blood will be filled and it looks pink in color. But this process becomes very slow in the Ailanthus. The more zymotic the type, the more sluggish the circulation, and in this remedy especially in this is this state present. So the congested condition of the skin is present even when there is no rash. A passive congestion of the veins is seen. In the low types there is fetid odor, that is sometimes cadaveric or stinking meat odor will be there. He compares here with veratrum viridi, where there is vasomotor paralysis, that when a line upon the skin is made by pressure will remain a long time. So that is what he compares with veratrum viridi. The miliary rash and scarlet fever or measles will appear in patches. There are little circles here and there and is dark in color. So this disappear on pressure and return very slowly. This is the feature which you can examine and confirm the remedy. So they are interspersed with the small vesicles mainly on forehead, head, neck and chest. The eruptions appeared scantily for 2 days with sore throat and mild fever like petechiae. He compares here with many other remedies like aconite, belladonna, pulsatilla, lachesis, arum triphyllum and phosphorus. He says in Ailanthus, as we know, the rashes will be irregular, patchy, livid eruptions of a bluish tint with fever which disappears on blanching and returns very slowly. This is what you have to remember in Ailanthus rashes. Okay, this is the characteristic of Ailanthus. Same thing in the aconite, you will have scanty zymosis. Okay, there also you have scanty rashes. Then in belladonna, the rash will be very shiny and smooth. Typical Sydenham rash will be observed. Reddish, almost red meat, like that. Then pulsatilla, you will find measly rash and often associated with low form of fever, but not so low as the typhoid type. In lachesis, there is zymotic state with rashes, prostration, aggravation after sleep, general stupor and delirium. These are the associated symptoms in the lachesis. In arum triphyllum, scarlet fever where there is a scanty rash, but the child keeps on picking up the skin from the lips and the nose. Lies in a state of pallor and exhaustion. There is no rash and the urine is suppressed. So this is seen in the arum triphyllum. In phosphorus, there is horrible fever with sore throat. Child cannot get water cold enough. Wants a stream of water running down the throat all the time. Okay, so this is seen in the phosphorus. This is how Kent differentiates the scarlet fever with the rashes especially in different remedies. I hope this has helped you to understand Ailanthus with some comparing it with some remedies. Thank you.